Hi, Mrs. Jones. My name is Nicole. I'm going to be your student nurse today.
Hey, Nicole.
Hi, I have your physician's orders. He's ordered for you just to have vancomycin administered for your infection that you have. Vancomycin is an anti-infective, and it's used to treat potentially life-threatening infections when other anti-infectives are contraindicated. I am going to administer this medication via piggyback, and there is a primary and IV infusing. So, per my doctor's orders, the physician has ordered 500 milligrams every 6 hours, and I've done my calculations. The vancomycin is available in 250 milligrams per milliliter, so I'm going to administer 2 milliliters of vancomycin today into the IV piggyback. I have my drop factor on my bag that's containing my tubing, so I know that that's going to be 10. And so through my dosage and my drip factor, I've calculated 14 drops per minute for the vancomycin today. So I'm going to wash my hands and apply clean gloves. I'm going to assemble my medication and my solution, and I'm going to administer or add the medication to the mini bag using aseptic technique. So again, I'm going to drop 2 milliliters of vancomycin. Okay, so I have my medication. And I'm going to use aseptic technique to wet the port. And then I'll administer the vancomycin into the port. Okay, and I will carefully mix the medication in the solution. Okay, so I have a label prepared, and it has the patient's name, the drug, the dose, which is 2 milliliters per time, and my initials. And I'm going to attach that to my mini bag. And now I'm going to attach my needleless device from my tubing to my mini bag. Also, again, maintaining aseptic technique. So I'm going to prime my tubing, prime the chamber about halfway. Allow for it to flow, and there we go. It's primed. Okay. And I have that. All right, Mrs. Jones. Can you go ahead and state your name, your full name for me,
Sarah Jones,
and your date of birth?
5/28/66.
Okay, so I have that medication prepared for you. Do you have any allergies that I should know about?
No, I don't.
Okay, so I'm going to palpate the site for phlebitis or infiltration. There is none. Okay, so I have, like I said, I have your medication, so we can treat that infection that you have and help it to go away, okay? Okay, so, just gonna hand that. And I'm going to lower my primary tubing so that it is lower than the piggyback medication administration. I'm going to clean my port with alcohol and connect the mini bag to the IV. Okay, I'm going to clamp my primary tubing, and I'm going to unclamp my piggyback and set the flow rate, which is 14 drops per minute. So I'm going to set that and make sure it's right, and it is. Now I'm going to remove my gloves and wash my hands. I'm going to observe the infusion throughout the procedure. And when it's complete, I'm going to come back, I'm going to wash my hands, I'm going to apply clean gloves, I'm going to clamp the piggyback. Doing all right, Mrs. Jones?
I am, Nicole.
Okay,
Thank
good.
you.
I'm going to unclamp the primary tubing. I'm going to disconnect my piggyback. I'm going to apply a new alligator clip to the piggyback for the next use so that it's ready. And I'm going to reestablish the flow rate of the primary tubing. So the primary tubing flow rate is reestablished. I'm going to dispose of all of my needles and syringes into the Sharps container. I'm going to monitor the site for pain, swelling, tenderness, or redness. Do you have any pain or tenderness when I palpate
No, I
in
don't.
this area? Great, okay. Do you have any pain overall, Mrs. Jones?
No, I'm great, Nicole.
Okay. Do you have to use the restroom?
No, honey, I'm good.
Okay. And I'm going to put the position back to the lowest position of the bed. And I'm going to make sure Mrs. Jones has all of her personal belongings. All right. Thank you, Mrs. Jones. Please let me know if you have anything. Here's your call bell, okay? If you need anything, let me know.
Thank you, Nicole.
Okay, thank you. And so now that I've completed the IV piggyback, I'm going to document in the medication administration record the time, the drug, which is vancomycin, the dose, which is 2 milliliters, and the route, the condition of the site, which is patent, no phlebitis or infiltration, and the volume of fluid on the medication administration record and or the intake and output record. Thank you.